Next, let us discuss a very important aspect of general pediatrics, that is normal development of a child. For your final year MBBS, this is one of the surest topics you will find in your theory paper as well as MCQs. You will find it in being asked in your practicals and even for future. So if you take up MD Pediatrics, this is going to be one of the areas you'll deal on a daily basis. Even if you're not going to be a pediatrician, you're all going to be doctors and you're all going to be parents. So you will be dealing with kids, and so normal development will always be required at some level. The problem is, it is very troublesome to remember these development milestones. So I'll be moving in a systematic manner rather than just simply showing you tables or making you write lengthy lines or lengthy facts. I'll be discussing with you what that fact means, what is the importance of that fact, and how it can be asked to you in your entrance exam, so that retention is a bit better. But end of the day, you need to understand, you need to write them down, you need to listen to these videos multiple times and practice in MCQ. So let us begin with the normal development. The first thing is, there are 6 rules of normal development that we talk about. So what are the 6 rules of normal development? The first rule says that development is always a continuous process and it begins in utero and continues throughout life. So the development, particularly development in children, is a continuous process. And the process begins in utero. If you talk about the physical development, that continues and reaches peak somewhere around adolescent or adulthood period, but the mental development is something which continues lifelong. So the first thing is, development is a continuous process. The second rule of development says that it is the CNS maturity which is a major determinant. In other words, how fast the child will develop and acquire a particular milestone will depend upon his or her CNS maturity. The third important rule for normal development says development always proceeds, I'm using a colorful pen, potential MCQ, cephalocaudal progression. Cephalocaudal progression occurs in case of development. What is cephalocaudal? Cephalocaudal basically means that initially your upper half of the body, the head and neck milestones are attained first, followed by the distal limbs are attained first. Similarly, if you look at the limbs, proximal muscle milestones are attained first, distal ones come later. So it is a central axis to distal axis and cephalo to caudal progression, which is seen in patients, in children undergoing normal development. The fourth rule of normal development says that primitive reflexes must be lost for the normal development to continue. As we will take examples of these, there are some primitive reflexes which interfere with the development of a normal reflex, and so they have to go away. Only when they go away that the new reflex will take its place. The fifth rule of normal development says that initially the reflexes are very general or crude. As progression occurs, the reflexes, the milestones, they tend to become more complex. So initial part of life, first year of life, the reflexes, the milestones which are attained, they are more of a general crude nature. As progression occurs, they tend to become more complex. And the sixth rule says a similar sequence occurs in all children. If there is a break in sequence, it tells you that there is a problem. It indicates probably the child is developing developmental delay. So these are the 6 rules of normal development in a child. From entrance point of view, the thing which can be asked in MCQs is the word cephalocaudal progression, which I have written in a separate word. The other 6 things are something you need to understand. You need not cram them up. Theory paper, sometimes they can be asked. So with these 6 rules in mind, let us proceed towards the individual normal development milestones. The development milestones, I have categorized them into 5 domains or 5 spheres. There is gross motor, fine motor, language, personal social, which are also called as cognitive, and fifth are the miscellaneous ones, where I shall be talking about the visual, hearing and some positional milestones. So let us begin with the first category, that is so I'll give the heading gross motor milestones. I'll keep on writing as well as I will keep on explaining. The first gross motor milestone to be attained is called as neck holding milestone, also called as head control. So the first milestone that you need to remember is neck control. It is also called as head holding. This milestone, according to Nelson and Illingworth, is of two types. First, you have the partial neck control coming, which is also called as incomplete or beginning of head control. That comes at 2 months of age. Whereas complete head control comes at around 3 to 4 months of age. When do you say the patient is having complete head control? There will be on performing a maneuver known as pull to sit. On pull to sit maneuver, there will be no head lag. Now what does it mean? Instead of explaining it separately, I am explaining as a part of this this milestone only. Now what we do is, you have a child in front of you. So you'll make the child lie supine on a bed. Then you hold the elbows of the child, both the elbows, and slowly pull him to sitting position and see what happens. If the trunk comes first and head is hanging behind like this, there is a head lag. Head lag indicates there is no complete head control. Head control may have started, but it is still not there. When you try to pull like this and neck, head and the trunk, they all come together, we call it as complete head control has come. So the maneuver used to check whether the complete head control is present or not is called as pull to sit maneuver. I could have made you write this down, but it is better that you write only the relevant points, keeping in mind understanding what the particular thing means. When you understand a thing, cramming them up becomes all the more easy. So if I have to show you a picture, look at this child. Which maneuver is being performed? What all MCQs can be asked? What all Viva things can be asked? We'll discuss simultaneously here only. They will ask which maneuver is being done. Your answer will be pull to sit maneuver. As you can see, holding the elbows of the child, we are bringing him to sitting position. Look at this and tell what is the interpretation. In this photograph, head lag is present. As you can see, the trunk is coming, but the head is lagging behind. Because head is lagging behind, so the age of the child should be less than 3 months, and that will be your answer. So this is how you're supposed to. Milestones are there in every textbook. They are there, you can Google and get them. The purpose of me taking this detailed module is you understand the meaning, and if you understand the meaning, trust me, there is no reason milestone should not have 100% accuracy. You should not have 100% accuracy in entrance exams. So this child is having head lag on pull to sit, so the age of the child should be less than 3 months, because when it goes away, the child's head control is supposed to have come. As we see in this picture, can you see now when the child is being pulled, his head and neck is coming with the trunk. So there is no head lag in this child. And so the age of the child at least 3 to 4 months is there, or you can say that head control in this child has been attained. So this is the first milestone that you need to remember, that is neck control or head holding. Then you have another milestone on which MCQ was asked some years back. It is not prominently given in Ghai, but given in Nelson. When is the child able to suck his own great toe? You and me cannot do that. Bringing the foot all the way to the mouth and folding it. The child can do that. So sucking the own great toe, which is also written technically as feet to mouth in supine position. Feet to mouth in supine position. The answer to this question is it comes at 5 months of age. So you may get a MCQ with a photograph like this. Look at this picture and tell what is the age at which this is attained. The answer will be 5 months of age. So moving over, then comes sitting with own support. Sitting with own support. Sitting with own support is also called as tripod position. 2 MCQs on this have been asked in the past. So sitting with own support or tripod position comes at 6 months of age. This is how tripod position looks like. So the two buttocks, and in front the child is leaning ahead. So the body weight is being supported on 3 points. Two buttocks, one in front. That is called as sitting with own support or tripod position. It comes at 6 months of age. Then you have a term called as roll over. Roll over. Hindi mein we call it as karvat lena. Technically it is called as rollover. Now rollover, Ghai gives a very single value attainment between 4 to 6 months of age. However, rollover is of multiple types and we have to be prepared for any complex question. So we'll go according to Nelson here. Nelson as well as O.P. Ghai, they say that rollover begins at 4 to 6 months of age. But at 4 to 6 months, it is only back to side and side to back. Right? If the question says, when is the child able to do prone to supine rollover? Prone to supine rollover, that comes at 6 months of age. And supine to prone, that comes at 7 months of age. Then we have sitting without support. So this is the rollover thing. Then sitting without support, that comes at 8 months of age. Then begins your crawling and creeping. Crawling comes again 8 to 9 months and creeping comes 1 month later, around 9 to 10 months. Now, what is the difference between crawling and creeping? Understand this. Around 8 to 9 months, the child is able to mobilize, move, locate from one place to another. He uses all 4 limbs. When child uses all 4 limbs and the abdomen is touching the ground, we call it as crawling. If the abdomen is lifted above the ground, it is creeping. So very simple. Child is coming to you on all 4 limbs. Look at the shirt of the child. If shirt is dirty, it is crawling. If shirt is clean, no dirt has been attached there, it is creeping. So crawling versus creeping. If I have to show you a picture, you may get a visual on this. So this is, question asks you, what is this child doing? This is crawling because the abdomen is touching the ground. And this is creeping. The abdomen is lifted above the ground. So there is an attainment gap of 1 month between the two milestones. Then comes your standing with support. Standing with support comes at 9 months of age. Then there is a thing known as pivoting. The term pivoting refers to rotating in a sitting position. So pivoting basically refers to rotating in a sitting position. MCQ on this has been asked. What is pivoting? I am a child. I have still not learned to walk around. I am sitting here, sitting position, but there is a toy kept on the side. I see the toy, I have to lift it. How do I do that? In sitting position, I will rotate myself in that position only, lifting my buttocks, pick that, and again rotate. Sitting position, I will come back to that normal position. That is called as pivoting, rotating in a sitting position. So that is attained at 9 to 10 months of age. So it comes at 9 to 10 months of age. Then comes your cruising. What is cruising? Cruising refers the child walks holding on to furniture. So cruising is holding on to furniture. The child moves from one place to another. So holding to furniture, the child moves. That begins at 11 months. So if I have to show you a picture of cruising, this is how cruising is looking like. So this cute baby girl is walking, holding on to a furniture. This is called as cruising. So these 3 C's are important: crawling, creeping and cruising. 8 to 9, 9 to 10 and 11 months. There is a gap of approximately 1 month between the attainment of these 3 C's. This has been asked as MCQ, this has been asked as MCQ, this has been asked as MCQ, this has been asked as MCQ. So all 4 are MCQs already asked in the past. So that is why I'm spending a lot of time to explain all these things. Entrance examiners sometimes don't ask you directly, cruising begins at what age. They will say, a child has recently learned to walk holding on to furniture. What is the age at which it begins? So they are talking about cruising, and the answer will be 11 months. Moving over, at 12 months of age, the child is able to stand without support. That comes at 12 months. And when he's standing, he will also be able to walk, but not without support, with support. So walking with support. When you say walking with support, it is different from cruising, because we say walking with support is defined by one hand held. You are holding the hand of the child and the child is walking with support. That both of them are attained at 12 months. So furniture walking independently, using that along the axis of that furniture, comes 1 month earlier. Walking in all directions, holding on to one hand of the parent, is attained 1 month later, that is at 12 months. Then comes your walking without support. Walking without support comes at 15 months of age. Then comes your running. Initially, child runs stiffly, then he runs rapidly. Running comes at 18 months. Walking backwards, taking backward steps, comes at 2 years of age. This is a new milestone mentioned in the major textbooks these days. It is not there in OPGAI but can be asked in exam. So you can put a star saying new milestone. Milestone has been there since man is there, but prominently mentioned in tables, it has been recently introduced. So walking backwards. Walking backwards does not mean the child is doing a moonwalk like Michael Jackson. Walking backward means simply taking one step at a time on the back. Then at 3 years, the child is able to ride a tricycle. So ride a tricycle, 3 पहिए का cycle, that comes at 3 years of age. At 3 years, the child is able to stand momentarily on one foot also. Obviously momentarily. So standing on one foot also comes at 3 years of age. Hopping, also called as skipping on one foot, comes at 4 years of age. What is hopping? Look at this picture. This girl is doing hopping. There are a lot of common games which children play. One of them is where they collect all these things and they have to catch hold of the other kid. Hopping on one foot. When is the child able to play that? That comes at 4 years of age onwards. And finally, you have skipping a rope. Skipping a rope is also sometimes written in textbooks as skipping on both feet. That comes at 5 years of age. So this is a photograph. This is 4 years, the milestone begins. This is 5 years when the milestone begins. So this finishes our first thing, that is gross motor milestones. Now there is a very controversial thing. There are two controversial things in fact in gross motor milestones. One is toe walking. Difficult MCQs in central institutes are asked and people get confused. And second are the stair walking. So I have dealt them separately so that you are able to understand them in depth. So what is toe walking? There is an old controversy on that. Now it is also called as tiptoe walking. There is first thing called as physiological or transient toe walk, which begins between 15 to 18 months of age. So physiologically, every child will walk on toes between 15 to 18 months. It usually stops by 2 years of age. So 18 months it will stop in the next 6 months. Second is idiopathic toe walking. Idiopathic toe walking means when the child is walking on toes even beyond 2 to 3 years of age, and this tends to improve with time. So idiopathic means the child does not have any neuromuscular disorder or developmental delay. It's just that child is in the bad habit of walking on toes. So it tends to improve again in the next 2 or 3 years. So if it persists beyond 2 to 3 years, one possibility is idiopathic toe walking. And then you have toe walking on command. Toe walking on command, or when asked, it begins at 30 months of age or 2.5 years. So all the three are different milestones. One is physiological toe walking. Physiological starts 15 to 18 months, stops by 2 years. And when does toe walking on command begins? It begins at 30 months or 2.5 years of age. I have not written when does it go away, because it does not go away on command. If you ask me to tiptoe, I can also do that. So these terms which are mentioned, you need to remember for difficult past MCQs, particularly Central Institute MCQs. You may get question like this. Look at this question. The question says, child has recently learned to walk like this on command. As shown in the picture, what is the age at which this milestone usually begins? So the child has recently learned to walk like that. This is physiological tiptoe walking. The answer will be 18 months of age. So this is how questions are asked. Next, moving over to stair walking, which is a source of controversial MCQs. Now, understand that the references I have used here, Nelson 21st editions, CDC guidelines, Illingworth and Ghai, because different books say different things. So I need to be ready with my proof, my reference material. So on one side, you have the milestone of stairs, other side, time of appearance. At 15 months, the child is able to crawl or creep upstairs. So crawling, creeping upstairs comes at 15 months. If somebody asks you, when does the child crawl or creep downstairs? Ask that person to do it himself or herself. You will fall down. The child is smart. He will not crawl downstairs. He knows he can fall. So child only crawls or creeps upstairs. There is no such milestone as crawling or creeping downstairs. So first is crawling, creeping upstairs at 15 months. Next you have going up and downstairs holding something, holding support. That comes at 18 months of age. Then comes your independent without support. Going upstairs and downstairs alone. Alone means without any support. That comes at 2 years of age. But here the child is walking 2 feet at each step. What it means? The child will first on one stair, he will put both his feet. Then both his feet. Then both his feet. So the child does not walk alternately like we walk. No, that is known as alternate. What we do is alternate staircase walking. Child walks like this. One step, he keeps both steps. Another step, he keeps both feet. Another step, he keeps both feet. That is known as 2 feet at each step. It comes at 2 years of age. Indirect clinical question on this has been asked in AIMS entrance exam in 2018. Then child goes upstairs, alternate feet. Alternate feet means just the way we walk. That comes at 3 years. Nelson gives a range. It says 30 months onward it starts. Ghai, Illingworth and all the CDC guidelines, they say 36 months. So we have taken a 3 years or just before that it begins. And then you have going downstairs with alternate feet, which comes at 4 years of age. So these are controversial. You need to understand, and in MCQs, be careful about what language is being used. When question says 2 feet at each step, it is also written sometimes as using one step at a time. You understand? एक टाइम पे दोनों feet are coming at that step. So that is also written in MCQs as one step at a time. Alternate feet is also known as alternate steps. These wordings have been used in the AIMS entrance exam. So I am going slow, but I am to explain every milestone so that it becomes ingrained in your memory and nothing should surprise you when you sit in your exam. Otherwise, you will remember these tables, you'll keep forgetting them. Even if you remember the table, MCQ will come and you will not be able to answer it. So if you understand whatever I'm saying and just incorporate it once, twice after practicing, there is no reason why MCQs should go wrong. Now moving over from gross motors to the fine motor milestones. So let us now discuss fine motor milestones. In fine motor milestones, you need to understand that there is no fine motor milestone between 0 to 3 months. So there is no fine motor milestone which is attained at that age. The first fine motor milestone that you need to remember is mouthing of the objects. Child has a tendency to put everything in mouth. That begins between 4 to 6 months of age. So 4 to 6 months, mouthing begins. Then comes the grasp of the child. First is reach or grasp. You offer something to the child. Child will try to hold it using both hands like this. He will not hold like this. He will try to reach out using both. That is called as bidextrous reach. It is also written as bidextrous grasp. Bidextrous reach or grasp comes at 4 months of age. This is your NEET PG MCQ 2 years back. Stand-alone question was asked. At 6 months of age, it becomes a unidextrous grasp. So unidextrous, now the child approaches an object to hold using only one hand, not both hands. Now you offer something to the kid, he'll try to hold it like this, not like this. At 6 months only, the child is also able to transfer objects hand to hand. So that also comes at 6 months, 6 to 7 months. Then is your palmar grasp. What is palmar grasp? See, there is a palmar grasp reflex which is not there at this age group. We have discussed about neonatal reflexes separately. You need to look at that module. To summarize, there is a palmar grasp reflex in a newborn. You put something here and the child tends to hold it. That is a reflex in the child. When you go to your nurseries, many students I know are in the habit of taking pics of those young kids. So what they will do is they'll put their finger like this. Newborn will hold his fingers like this. This is called as palmar grasp reflex. Palmar grasp reflex, till the time it is there, these fine motor milestones will not come. When does it disappear? It disappears at 3 months. And so the fine motor milestones are starting after that period only. So that reflex is gone by 3 months. Now you have a voluntary grasp, that is not a reflex. What is palmar grasp? Palmar grasp means the child is not using mainly his fingers, he is using the fingers only to support it. The object is being held in the palm like this. So the object is being held and the thumb is never used in palmar grasp. So the child is holding things like this. That is known as palmar grasp. Initially, there is a ulnar palmar grasp, which is also immature palmar grasp. The ulnar palmar grasp comes at 6 months of age. And the radial palmar grasp, which is the mature one. If nothing is mentioned, you should answer according to radial palmar grasp, which comes at 8 months of age. So if I have to show you a picture, this is a child with mouthing of objects, right? This is a child with palmar grasp. See, the object is held mainly in the palm. Even if you remove 1 or 2 fingers, the object will not fall off. Here the thumb, even if you remove it, the object will not fall off, but it is a loose grip which is there. Then you have a pincer grasp. Pincer grasp is something which is very important. 4 to 5 times it has been asked in MCQ entrance exam. What is pincer grasp? When the child holds an object between the fingers like a pincer and the use of thumb is mandatory, that is called as pincer grasp. In palmar grasp, thumb may or may not be used. In pincer grasp, it is mandatory and it is the thumb which provides the strength to hold that object. That is why we call it as pincer grasp. Pincer grasp is immature initially. That comes at 9 months of age. And the mature pincer grasp comes at 12 months of age. What is the difference between the two? At 9 months, you give something to the child, he will hold between thumb and index finger, right? But it will not be the end of thumb and index finger, it will be the midpoint of thumb and index finger like this. This is called as immature pincer grasp. Immature pincer grasp. And when the child is holding at the end like this, the way you are supposed to, pen holding fashion, that is called as the mature or true pincer grasp. It is also called as true pincer grasp. That comes at 12 months of age. So if I have to show you picture, this is a child. Which type of grip is this? See, the palm is not being used. So this is pincer grasp, thumb is there. But it is not at the end of digits, but the midpoint of digits which is being held. So this is immature pincer grasp. And this one is your mature pincer grasp, where at the end of digits it is being held and it is held firmly. So that begins at 12 months of age. This is your mature pincer grasp. This is your radial palmar grasp. This is your mouthing of objects. So I hope all these things are making sense to you. Now, MCQ examiners can be really frustrating. Once a question came, when does a child learn to make scissor-like grip? What is a scissor? Kanchi. Scissor-like grip, when does it come? So people were stunned in the exam. So scissor-like grip, is it a milestone? Yes, the examiner is just trying to check whether you have understood and whether you can visualize or not. When you think of a scissor, kanchi, it is like this. There are two things in the front, there is a joining point and then there is two things in the end. So this is how a scissor looks like, right? This is how it looks like. So immature pincer grasp is also called as scissor-like grip. It is the alternative name. Why? Think of this, two scissor-like grip, two parts in the front, two parts at the back and a joining point in the center. So immature pincer grasp is sometimes also mentioned in some sophisticated textbooks as seizure-like grip, the answer will be 9 months. So by now you must have understood that it is very important to understand the meaning of whatever you are writing. Moving over, then comes your scribbling. The child holds a pen because now pencil grasp is mature, so he'll hold a pen and he will scribble and just make lines like this. Scribbling begins between 15 to 18 months of age. There is a range given in most of the textbooks. And then comes your figure making, also called as figure copying. Figure making or figure copying is the same thing. The child is able to make, this is very important again, the child is able to make a vertical line initially. A vertical line forming, that comes at 18 months of age. So the child will form a vertical line like this. The child is able to make a horizontal line at 24 months, that is 2 years of age. So horizontal line will be this. The child is able to make a circle at 3 years of age. So a circle will come at 3 years. The child is able to make a square or a rectangle or a plus sign, which comes at 4 years of age. The child so this photograph, or if the question says plus sign, that all will come at 4 years of age. Then triangle or multiplication sign comes at 5 years of age. So triangle or multiplication sign will come at 5 years of age. And finally you have rhomboid shape. Rhomboid is also written as diamond shape, which comes between 6 to 7 years of age. Rhomboid is defined as this picture, also called as kite-like picture. So rhomboid or diamond comes at 6 to 7 years. Now there was a very interesting question which came in entrance exam, and it is sometimes examiners also ask. It is not written in the books. Half of the things which I am telling you, they are based upon what has been asked. So they are practical aspects. So there was a question, when does a child first learn to make a cross? Options given were 2 year, 3 year, 4 year, 5 year. Now people knew it is not 2 year, it is not 3 year, it is either 4 or 5. Now the question arises, what do you call as cross? Is this cross or is this cross? The answer to that question is 4 years. Why? Because this plus sign is also called as cross sign. So what is this sign? This X. This is also called as tilted cross. So tilted cross comes at 5 years of age. So be careful in the exam. Cross is plus sign. Tilted cross is this sign. Some of the people were not satisfied. They said, sir, I call this as cross. What you call doesn't matter. What is there, it is what is important. So when you have all those movies, there is an assassin who's putting up a photograph and putting a cross. He's not putting a cross. He's putting a tilted cross there. There is another thing called as inverted cross, but it is not a milestone. Inverted cross is seen in horror movies like Conjuring series. So we'll not go there. We'll talk about normal development. So how to remember this? Again, there is a silly but interesting way to remember. You can make a picture of a girl wearing a hat. What does it mean? Remember this picture, what I'm going to make. First of all, vertical line comes. Okay, that comes at 18 months. Then comes a horizontal line at 2 years of age. Then comes a circle at 3 years of age. Then comes a plus sign at 4 years of age. Then comes a square or rectangle, again 4 to 4.5 years. Then comes your triangle, which comes at 5 years of age. This is the skirt of the girl. And then finally, you have the feet shown like this. That is the rhomboid shape, which comes at 6 to 7 years. So this picture is easy to remember, to revise when you make your notes. So this is how we remember the fine motor milestones in case of kids. And last aspect of fine motors is left. You give color cubes to the child plays with them to make blocks. How are those blocks helpful in knowing the age of the child? So tower a structure using colored cubes. So first of all, the child is able to use 2 cubes. So you will write 2 cube tower. That comes at 15 months of age. So 2 cube tower will look like this, as you can see picture. The child is able to make 3 to 4 cube tower at 18 months. So they will put up a photograph like this and ask you, the child is able to make this. What is the age of the child? Answer will be 18 months. Child is able to make a 6 to 7 cube tower. That comes at 2 years, that is 24 months. They'll put up a photograph like this and ask, when does the child is able to make this? The answer will be 24 months. Then 9 to 10 cube tower. 9 to 10 cube tower comes at 36 months, that is 3 years of age. So they'll put up a photograph like this and ask, when is a child able to make this? The answer will be 3 years. Don't worry, examiners will not ask when is a child able to make 20 cubes. It is not possible. There is a thing called as gravity. I hope you know it. So gravity will come into play. So only up to 10 cubes is what we do it. So if somebody asks you, try to make a 20 cube tower, first tell that person, first you make it, then I will make it. So 9 to 10 cube tower, 3 years of age. Then there is a thing, very interesting thing, known as train making. So I'm writing with a colorful pen. Train making. Train making is of 2 types. Without chimney. See, the child is becoming an engineer now. And with chimney. So without chimney comes at 2 years of age. And without chimney comes at 2.5 years, that is 30 months of age. So what is train? This is a train. The child is not vertically putting one over the other. Child is horizontally stacking them end to end. That is known as train without chimney. This is train with chimney. Now the child is able to make one line horizontally and one portion above that vertically. That is known as train with chimney. You may get a photograph and be asked what is this structure being made. It is train with chimney. Age minimum 30 months. 2.5 years of age it begins. Then you have bridge of cubes. Now the child is a full-blown engineer. Bridge of 3 cubes. Bridge of 3 cubes comes at 3 years of age. This is how bridge of 3 cube looks like. Gate of 5 cubes comes at 4 years of age. This is gate of 5 cubes. And finally, the child has reached IIT. Now he is able to make staircase. Staircase making, that comes between 5.5 to 6 years of age. This is staircase making. So you may get photograph like this and they will ask, what is the age of attainment? There is a purposeful reason. You can increase the speed during revision. There is a purposeful reason I am going slow. I could have just shown you tables and be done with it. But I want everyone listening to this video to have a 100% strike rate. And it's a bit more interesting if you do it this way. It also ensures, once I will be done with this video, you can be sure that at least 50% of your MCQs, which have been asked in the past in all exams, are already there in a discussion manner, which we have discussed. So you can practice those out in the question bank. Now finally, we move over to the language milestones. Don't worry, language milestones will not have visuals. Language milestones will not have those audio questions because still the entrance exams have not yet evolved to that extent. So we'll give the heading language milestones. In language milestones, at 3 months of age, the child is able to do cooing. Cooing is producing musical vowel sounds. At 4 months of age, the child is able to laugh loudly. At 6 months of age, monosyllables come. What are monosyllables? Ma, pa, da, cha, ka. That is 6 months. Between 6 to 7 months again, mostly textbooks say at a gap of about 3 to 4 weeks. So that means 6 to 7 months. After monosyllables have been obtained, the child will have babbling coming. So babbling does not come before monosyllables. It comes a few weeks later. Babbling is that is babbling. Then you have 9 months. Repeating the same syllable twice, bisyllables. Mama, papa, dada, chacha, kaka. 9 months of age. Then you have 12 months. 12 months, the child is able to speak first real word. And the number of words which are spoken are only 1 to 2. So first real word comes at 12 months of age. Here the child is able to join 2 sounds, different syllables together. 9 months he was speaking the same one two times. Mama, papa. Pa is being spoken twice. Here the child will use 2 different words. Aja, khaja, naja. It may or may not mean anything. But He's able to join two sounds to form a proper word. That is 12 months of age. At 15 months, this is your MCQ point. 15 months, the child is able to do jargon speech. Very important. What is jargon speech? Now, 15 months of age, child is able to understand the things, but his vocabulary is less. So, he will create simple new words to indicate his common needs. And jargon speech is something which varies according to language spoken. So, it is different in different languages. What does jargon speech means? Example, child in a Hindi speaking area, you would often notice that the child will have, if he wants milk. So whenever he asks for milk, he cries for milk, everybody around him is saying, doodh lao, doodh lao. Now the child cannot say doodh. So he creates a simple sound, he says boo. For him, it is very clear that boo means doodh. Boo is not the meaning, does not mean doodh actually, but the child forms a word to indicate his specific need. So he would say boo. You bring him anything, he will not take it. Once he gets boo, that is milk, he would be fine with it. So pani ke liye, water, they will call it as mum. Doodh ke liye, they will call it as boo. For their favorite toy, they will call it as ji. That ji means that favorite toy. And it may be different in case of different languages. In Tamil, they will say, use a slightly different sound. In Spanish, they would use a different sound, and so on. It depends upon the language which is being spoken at home. But jargon speech indicates the child is now becoming more and more intelligent. So this is the jargon speech. Case-based scenario can be asked in exam. That is why I have explained the meaning of this. Moving over, at 18 months of age, the child is able to speak 8 to 10 words. So the vocabulary is having 8 to 10 words. At 2 years of age, the child can speak two things. The child has a vocabulary of more than 50 words, approximately 100 words. And the child is also able to speak two-word sentences. Like, ma, shoe, mother, get me shoe. That's it. Two-word sentences the child is able to form. At 3 years of age, 3 years is important. All the milestones at 3 years are often asked in entrance exam. So 3 years, the child is able to do multiple things. The child is able to speak his name, age, as well as sex, that is gender. The child is also able to speak 250 words. So the child has a vocabulary of 250 words. And thirdly, the child is able to speak 6-syllable sentence. So sentence which has 6 syllables in it. They may not be complex words, but 6 syllables will be present in that milestone, in that sentence. Then at 4 years, the child will be able to tell a story, a song, or a poem. So all that nonsense about Baba Black Sheep, Humpty Dumpty and stuff like those, Twinkle Twinkle Little Star, they all begin to come at 4 years of age. Child does not know who Humpty Dumpty is, but the child is being taught and the child is just saying it out, is able to remember that and say it out loud. So that poem saying comes at 4 years of age. So you understand now that how the system is like that. Cramming the things begins at a very early age. So story, song or poem. But the child is able to understand also, and the child is able to narrate a story also. And finally, 5 years, the child is able to do two things. Child uses future tense. I will do that. So using future tense comes at 5 years of age. 10-syllable sentences. The child is able to speak 10-syllable sentences at 5 years of age. Again, very interesting thing. Examiner asked in one of the MCQ entrance, when does the child learn to use past tense? Now, students were baffled. They said, so this is not milestone. This is a milestone. Whatever you need is written right there. The question is, do you understand it and do you recall it? How do you tell a story? Once upon a time. Once upon a time means the child is able to use past tense. And so, in bracket you can write, using past tense also comes at 4 years of age. So this is the meaning of the terms which are asked in MCQ entrance, and they are sometimes asked in your vivas, final year vivas as well. And finally, the fourth domain, that is social cognitive milestones. So it is done under multiple headings. We call it as personal social milestones. It is also written as cognitive because the higher mental functions are now getting involved. So personal, social or cognitive milestones. Let us begin. It's very interesting as well. It's a big list, but it's important. First is spontaneous smile. Spontaneous smile is not given in the table of OP Ghai, but has been asked in NEET PG style past papers. So spontaneous smile. Spontaneous smile means the child does not like to smile. There is no reason for that to smile, but he's smiling just for the sake of it. You are seeing through CCTV, the child is sleeping and smiling. That is called a spontaneous smile. It begins in the neonatal period itself. So spontaneous smile starts in the neonatal period. Then you have social smile. What is social smile? Social smile comes at 2 months of age. Social smile means the child is not smiling just like that. Child is smiling in response to a stimulus. For example, you have a child in front of you. You start making faces in front of the child. All those funny faces that you make. The child looks at you. He doesn't like you, but he doesn't know much to do and he's not in the mood of crying. So he will smile at you. That is social smile. Social smile means social. You're walking, you meet a person, you don't like that person, but that person says hi to you. So in return, you also acknowledge that. That is called as social smile. Then you have recognizing mother. Recognizing mother comes at 3 months of age. People get confused between social smile and recognizing mother. You'll have random relatives coming to meet a child who was just born 2-3 months back. They will pick up the child in their lap, make all those faces. Child will smile at them and they would say, "Arey, the child has recognized his uncle." Child has not recognized his uncle. He's simply giving you a social smile. He will recognize mother first of all, not you, random uncle. Sometimes he does not know who this person is. So social smile is just smiling for the sake of it. Recognizing mother as the caretaker is the first thing to happen. Mother here means the caretaker. Usually mother is the caretaker, so recognizing mother. If mother is not around, if father or aunt or grandmother or grandfather are taking care more often, then the child will recognize that caretaker first. So the correct word should be caretaker, but it is usually mother, so we say recognizing mother. Then we have a question called as, a thing called as hand regard. Hand regard has been asked in MCQ entrance exam. What is hand regard? Hand regard begins at 12 weeks and it stops at 20 weeks. So it begins at 3 months of age and stops by 5 months of age. What is hand regard? In a lying down child will keep intently looking at his hand like this. He has nothing else to do, so he is looking at his hand. 5 months of age, he realizes, oh, this is my hand. Let's look around. So that hand regard begins at 3 months, ends at 5 months. Persistence of hand regard beyond 5 to 6 months is considered to be indicative of developmental delay in the child, and that is why hand regard is important. So you may get visual like this. Look at this picture and tell what this child is doing. The child is intently looking at his hand. This is hand regard. Begins 12 weeks, ends at 20 weeks. Then is your smiling at mirror image. Then smiling at mirror image. The child begins to smile at mirror image around 5 months of age. And the child is able to play or vocalize looking at mirror image at 6 months of age. It is also called as mirror play. What is the difference between the two? At 5 months of age, the child will look at his image in the mirror and will only smile. That is smiling at mirror image. When the child jumps, squeaks, produces sound or tries to touch his image in the mirror, that is called as mirror play, which comes usually around 4 weeks later, around 6 months of age. So you may have two type of questions. If photograph has a child simply looking at the image, that is smiling at mirror image. If the child is trying to play around, then it is called as mirror play, that comes at 6 months of age. Now look at the other picture which I am showing. This is 5 months, this is 6 months onwards. So there is a small gap between the two, but can be an important thing. Another important thing is stranger anxiety. Stranger anxiety means the child is now anxious on looking at new faces. That comes at 6 months. Some books give a value of 7 months also. So 6 to 7 months is stranger anxiety, getting afraid of new faces. Then is object permanence. or constancy of the objects, also called as constancy, that comes at 9 months of age. What is object permanence or constancy? Before 9 months, the child is asking for a ball drops or ball is taken away from the field of vision. The child thinks the ball does not exist. That is called as absence of object permanence. So the child thinks what is not visible does not exist. But 9 months onwards, child knows that objects can exist even if they are not visible. So you hide that thing, child will still cry and he would say, I'm not a fool. Now I'm 9 months of age, my brain is mature enough to understand that you have hidden that object, get me that object ASAP. That is called as object permanence. This is the time during which objects appearing and disappearing makes the child interested because he has recently learned that skill. So a game known as peek-a-boo comes at 10 months of age. The child is able and enjoys that game. What is peekaboo? Child is lying down, you cover your face and then say, hello. The child smiles, squeaks out in laughter. That is playing peekaboo. So that comes at 10 months of age. This, and this. All four are MCQs already asked in past NEET PG exams in one way or the other. So you must remember them for the future as well. Moving over, then the child is able to play a simple ball game at 12 months. The child is able to do domestic mimicry. He is able to mimic whatever actions are happening at home, like mimicking sweeping action, mimicking cleaning action. That begins at 18 months of age. So domestic mimicry comes at 18 months. Then the child is able to, then comes your feeding of the child. The child is able to drink from cup and feed with spoon at 15 months of age. We are doing this feeding milestone separately because they're separately sometimes asked. The key word to understand here is when he's feeding with spoon, the child will spills most. So he will eat less and spill more. Whereas feeding with spoon but eats most, spills less, that comes at 18 months of age. The child is able to use knife and fork at 30 to 36 months. So these are the feeding milestones that you need to remember, which are a part of the cognitive developmental thing of the child. Then the child is able to hug his parents, then his interaction with the parents. So you can give interaction with parents and others. Interaction milestones. The child is able to hug his parents when he is happy at 15 months. The child is able to kiss parents. The child learns to kiss at 18 months. Stupid way to remember. 18. At 18 months, the child learns to kiss. Obviously, parents. At 18 years, the child may move forward. Stupid logic always works. Suppose we meet 3 years later and I ask you which one milestone you remember. You may not remember any sophisticated milestone. Usually, social smile people always remember. Pincer grasp people always remember because you read it so many times, you answer it so many times in MCQs, and kissing parents comes at 18 months is something you always remember. So then the child has separation anxiety. This is different from stranger anxiety. Separation anxiety, also called as rapprochement, comes at 18 months. The child starts crying when the mother is not around. Stranger anxiety is afraid of new faces. Separation anxiety is familiar face, caretaker not being around. The child gets anxious. Child gets afraid. That is separation anxiety, which comes at 18 months. Can be asked separately from in MCQ entrance. Then interaction is happening. In between 2 to 3 years, child will show parallel play. What is parallel play? There is no interaction with other children. Other children are playing, he will not play with them. Play with his own toys. That is between 2 to 3 years. Then pretended play. Pretended play, again, the child is playing alone. That comes at 30 months. What is pretended play? In his mind, child thinks I am a commando. So he'll pick up a gun-like thing at home and stand in front of mirror and think that he's a commando. He's not playing out with other people. That is pretended play. Another child will take up a Barbie doll and start combing her hair, start applying nail color and doing all those things. That is child playing alone, but pretending that he is the caretaker of that doll. That is pretended play, comes at 30 months of age. Then comes your cooperative play, where the child shares his toys with others. That is 3 years. And finally, you have role play. So 4 types of plays are there. Role play, also called as group play. Children will take up roles. I am father, you are mother, this is son, this is daughter. This role playing will come at 4 years of age. So 4 types of plays you need to remember. So instead of going in a sequence wise, I have taken them and put them together so it is easy for you to remember when you revise your notes. And other than this, you have dressing and undressing milestones. Dressing and undressing, remember that undressing comes first, dressing comes later. So first you have undressing, taking off clothes with support, that is with help. That comes at 2 years of age. So undressing with support comes at 2 years of age. Then the child is able to dress and undress under supervision. Undressing has come, dressing with support comes at 3 years of age. And dressing and undressing independently, without any external help, comes at 5 years of age. Tying shoelaces also comes at 5 years of age. So tying of shoelaces also comes at 5 years of age. And finally, there are 2 things which people get confused. One is handedness. When does handedness develop? Right-handed or left-handed? That becomes established at 3 years of age. Whereas right-left discrimination begins at 4 years of age. So preferably using one hand to do something is called as handedness. Whereas knowing that this is right and this is left, that knowledge comes at 4 years of age. So please do not confuse the two. I have seen a lot of students every year mark these interchangeably, getting them wrong in the exam. So after these dressing and undressing milestones, we come to some miscellaneous milestones which have not been covered so far. So in miscellaneous milestones, first is your vision and hearing. When you check for vision, first of all, we'll check for vision. When you check for vision, the object should be kept. It should be a colored object so that it catches the attention of the child, and it should be kept 8 to 10 inches away. And see whether the child is able to fixate on that and move his or her eyeballs or not. So ऐसा नहीं कि you put it like this, child will not be able to see anything, or you put it like 1 kilometer away, child is not going to see it. Vision should be tested. How much distance? That is important. It is given in the books, it is asked in exam, nobody reads them properly. So 8 to 10 inches away, you keep that object, colorful object. Then what happens? The child is able to, once the child starts looking at that object, you move that object. So till what angle the child will follow that object? At birth, the child is able to follow up to 45 degrees. It is not vertical, horizontally. So up to 45 degrees, the child will be able to follow, then he will lose the object. At 4 weeks, the child is able to follow up to 90 degrees. At 12 weeks, that is 3 months, the child is able to follow up to 180 degrees. That means you start from here, the child looks at it. You slowly bring the object like this. This complete eyeball moving from here to here. The complete 180 degree position the child has moved. His eyes, that is 180 degrees, comes at 3 months of age. And at 4 months of age, the child tends to develop binocular vision. So these are the 4 things that you need to remember for exams. And then is your hearing. Let us talk about hearing. In the neonatal period, you produce a loud sound. The child only shows a startled response. And he may be stunned for a while and then start crying. That is called a startle response. So there is a sudden loud noise the child will be and then start crying. That is startle response present in the neonatal period. Then child is able to locate the sound. Then at 4 months of age, the child is able to localize sound horizontally. Horizontally means child is looking forward, suddenly there is a loud sound on the side, child will try to locate that sound by turning his head like this, only in horizontal direction. If the object is up or down or diagonally placed, he will not be able to do that. That comes at 4 months of age. At 5 to 6 months, the child acquires the ability to localize sound vertically but looking in a downward direction. The child is able to turn his head, then look down. At 7 months of age, the child is able to localize sound vertically but also in an upward direction. So he will look here, then turn his head towards that side. So this and this position, that is upward localization of sound. And finally, at 10 months of age, only 10 months, the child is able to localize sound diagonally. Diagonally means now the child need not do like this and this. Now the child is able to see at an angle like this. Diagonal localization of sound or looking like this. That diagonal angle comes at 10 months of age. See, horizontal is in the same plane. Vertical is first horizontal, then up and down. And then diagonal is at an angle directly, not having the need to just rotate and then move up and down. That is localization of sound. It's a bit tricky, yes, but for entrance exam, the thing which you leave is the one which gets you in trouble. So cover all the milestones. I'm not going into too many details, only focusing on the key areas. And finally, we have neonate in prone position on the bed. When you put a newborn on prone position, what exactly happens? At 2 weeks of age, when you put the newborn in, what is prone position? On the back is supine, on the front is prone. At 2 weeks of age, the legs of the child are folded. Legs of the child are folded and pelvis is lifted up. So when you put the child on prone position, this is how the child will look like. Can you see that the legs are folded and the pelvis is lifted up? It is above the axis of the body. At 6 weeks of age, the legs become straight. So legs are straightened and the pelvis is also horizontal, that is in a straight line. So look at this picture. At 6 weeks of age, this is the position which will happen. So the legs are now extended and the pelvis is now in the line of the body. At 3 months of age, the child will lift head and chin plus shoulder at 45 degrees and bears weight on the forearm. But the key word to remember here is the elbow here is flexed. Look at this picture. The elbow is flexed and so the child is able to bear weight mainly on the forearms and he is able to lift his head and trunk and the upper shoulders by 45 degrees. And finally, at 6 months of age, the child is able to bear weight on the arms which are straight and so the elbow is extended. So the entire arm bears the weight. This is the position. So the entire arm is now straight. The elbow is now extended. So 2 weeks, 6 weeks, 3 months and 6 months. So these are the key positions that you need to remember for exams. And lastly, what happens when there is vertical suspension of the child? Vertical suspension is not very frequently asked, but these are miscellaneous things, other areas which are not a part of the 4 typical gross motor, fine motor, language, social. So vertical suspension means now the child is prone, but he's not lying on the bed. You have lifted the child from his tummy. So this is the child, this is head. You have lifted the child like this. On vertical suspension, you do like this, lift the child and see what does the child do. In the neonatal period, the head sags down. At 1 month of age, the child is able to lift the head. So head is lifted momentarily. but then again it tends to fall down. So this is the head, this is the body. At neonatal period, head is sagging down. At 1 month of age, the child will lift his head and then again it will sag down. At 2 months of age, 2 months of age, postnatal age, the head is lifted and sustained in the plane of the body. That means now the child is able to lift head. It is not sagging down, it is lifted in the plane of the body for a considerable time. And at 3 months of age, the head is lifted above the plane of the body. So this is regarding the vertical suspension. This is a test which we do on physical examination. So newborn period, head sagging down. 1 month, lifts, unable to sustain. 2 month, sustained in the plane of the body. 3 month, lifted above plane of the body. So this is regarding vertical suspension. This summarizes all the milestones that you need to remember. There are milestones beyond this as well. But what we have done is, we have done twice the list given in textbooks of the usual MBBS level textbooks. We have done the list which is not blindly according to Nelson like textbooks, and I have tried to explain what these terms mean and how questions can be asked, and at least 50 to 60 MCQs have just been covered in various forms in the discussion itself. So this is regarding normal development. Let us talk about abnormal development and how do you assess that in the next module. After talking about the normal development milestone, it is appropriate that we talk about developmental assessment and some developmental abnormalities. The first thing which we need to discuss is development milestones. What are the practical application? What are the implications of these? Now, this is one topic which is not directly covered in OP-GHAI, but there is a huge, massive table given in Nelson 21st edition, and fortunately or unfortunately for students, questions are being asked. In fact, recent INI-CET had question on milestone asked directly from this table. It is a huge table and we need not go into the fine details, but still we'll be doing selective areas from that which can be asked in entrance exam. What do you mean by implication? A particular milestone getting attained has hidden meaning. It indicates a specific thing. That is what we call as developmental implication. So if the question says, what are the gross motor milestones, key gross motor milestones, and what are their implications which are important? So you, on one side you can write milestone, other side you can write the developmental implication. So if the child has no head lag on pull to sit, what is this milestone we are talking about? Complete neck control. Presence of complete neck control implies that there is muscle tone which is normal. So it is a marker of muscle tone. It is a marker of adequacy of the muscle tone. So in a young child, adequacy of muscle tone is indicated by a presence of no head lag on pull to sit, coming at an appropriate time. When the child is able to bring hands in the midline, it indicates that the child is having self-discovery of the hands. When the child is able to sit or walk without support, either of these two milestones, what are the implications? They have a role. It allows the child to explore. So exploration is the implication of this particular milestone. Second, we come to the fine motor milestones. In fine motor milestones, when the child is able to reach out for the objects, unidextrous or bidextrous grasp. So reaching out for objects indicates visuomotor coordination. So visual and motor coordination is indicated by reaching out for objects. Then I'm writing with a colorful pen because this is recently asked MCQ. Transfer objects from hand to hand. If the child is able to transfer objects hand to hand, what does it imply? It implies comparison of objects. This was your MCQ asked in INI-CET. Then the child has developed pincer grasp. What does it indicate? Development of pincer grasp indicates the child is able to explore and manipulate small objects. So the child has attained ability to explore and manipulate small objects. When the child is able to do scribbling, presence of scribbling again indicates visuomotor coordination. But here the visuomotor coordination, in the first case it is the gross motor and visual coordination, whereas here there is a fine motor and visual coordination which is happening. When the child is able to make tower of two cubes, it indicates that the child is able to the child has gained ability to use combination of objects or ability to use objects in combination. When the child has tower of 6 cubes, it indicates the child has ability to coordinate all the 3 spheres: gross motor, fine motor, as well as visual milestones. So this is the implication. Then language and personal social are very limited. In language milestone, remember that if the child is able to speak monosyllables or bisyllables, or the child is able to do babbling, it indicates experimentation with sound. Experimentation of sound is classically seen with monosyllables, and expression with sound is seen with bisyllables. And when the child is able to use among personal social sphere, the child is able to use uncovering and covering of objects. The child is able to uncover toys or plays peekaboo. It indicates child has ability to understand object permanence. It is only 10 to 15% of what actually is given in those tables and the texts given in Nelson as well as Illingworth. But those tables are neither needed at our level nor are they going to make any sense unless you go into MD pediatrics. Once you move into MD, then obviously you'll have to read them. But at MBBS level, for college entrance exam, for college level university based exams, you may need not these topics in full details. But if you're targeting central institutes and even NEET PG, next PG exam, you must go through these indicators, the developmental implications, because this is something new, something hot, something trending. Now moving over to red flag signs in development. What is red flag sign? See, we say that a particular milestone must be attained at a certain age. If that particular milestone is not attained by that age, it is a clue that the child is having delayed milestone. So there are certain milestones which are more important or better indicator than others. They are called as red flag signs. So red flag signs we can summarize. On one side you would write the milestone. Other side you would write the upper limit of attainment. Upper limit of attainment means by this age it should come by any means. If it not comes by any means, that means the child has developmental delay of that particular aspect. So if the child is unable to do visual fixation, he is not able to fix his gaze at any object by 2 months, we say the child is having developmental delay. Visual fixation has to come by 2 months. Vocalization has to come by 6 months. Sitting without support has to come by 10 months. Standing with support has to come by 12 months. Standing without support, walking without support, and using single words, simple or single words, all the three have to be attained by 18 months. And the child has to have imaginative play by 3 years of age. Pretended play or imaginative play by 3 years. If any of these are not attained by the age which is mentioned, it indicates a red flag sign and indicates developmental delay in the child. And also remember that loss of comprehension or reversal of milestones will always be abnormal. This is something which need not be put into a table. So after talking about these tricky things, let's move towards more simpler things. Terminology used in developmental assessment. There are three terms which are used in assessment of development. One is developmental dissociation, second is developmental deviation, and third is regression. So the first term is developmental or development dissociation. What is developmental dissociation? When there is variation in attainment of milestone in more than two or more domains, we call it as developmental dissociation. So variation in attainment of milestones across two or more domains, that is called as developmental dissociation. For example, a child is having gross motor, fine motor, social milestone normally, but language is delaying. It is very common in certain populations. That is called as developmental dissociation. It may be indicative of something, it may not be indicative of something. Suppose a child has not started vocalization at all, 8 months ho gaya, it is a red flag sign. So other markers are going normally. So that indicates that there is isolated language delay. Isolated language delay, if it is mild and catching up, then we don't need to do anything. But if there is severe danger sign, like the red flag sign we discussed, vocalization has not appeared at all, we need to not only check the oral apparatus, we also need to check for the hearing of the child, whether the child is able to hear or not. Only when he will hear, he will be able to acquire the ability to speak words. So language delay can also indicate involvement of abnormal hearing. And so this dissociation makes you investigate the child. The second term which is used in developmental assessment is development deviation. Development deviation is used when the proper sequence of attaining milestones is not seen. Proper attainment, like a particular milestone normally comes 6 months later, that comes earlier and the original one is not coming. Developmental deviation can be seen in multiple pathological conditions and usually has an organic basis. Organic basis means there is an underlying cause in that. The classic example, potential MCQ, name one common condition associated with developmental deviation. There is, the name of the condition is cerebral palsy. It can be seen in other CNS disorders as well. And the third category is development regression. I know these terms are a bit confusing, but have to be done. Developmental regression. Developmental regression is loss of previously acquired milestones. Already it had come, now it has gone away. Typically seen with, can you give any common diseases which have developmental regression? Yes, it is Rett syndrome. Any other condition you can think of? It can occur in some mitochondrial disorders. It can also occur in complication of measles, SSPE, where there is a progressive development of vegetative stage. So these are the terminologies that you need to know. Now we move towards, next we come to two very important areas which are asked in MCQs as well as asked in your practicals. Developmental quotient and intelligence quotient, DQ and IQ. So let us discuss them separately here. So on one side you would write DQ, other side you would write IQ. What is DQ? DQ stands for development quotient, whereas IQ stands for intelligence quotient. They appear similar, their formulas look to be similar, but they are entirely different from each other. What is developmental quotient? Developmental quotient is given by the formula developmental age of the child divided by his actual age, what we call as chronological age, multiplied by 100. This is the formula for developmental quotient. If the DQ, it is a MCQ point, if the DQ is less than 70, if it is less than 70, it indicates developmental delay. So it is a useful crude test you use clinically. If the DQ is less than 70 in 2 or more domains, that is gross motor and fine motor, gross motor and social, language and social, gross motor, fine motor and language, 3, that is 2 or more. So you would say the child is having global developmental delay. So these two definitions can be asked in your MCQs. How do you calculate? Now numerical on this has been once asked in old MCQ entrance exam. They will give you a question like this. 8-year-old child is able to copy a square but is not able to make triangle. Calculate the DQ of the child. Now this looks tricky. So let us go systematically here. What is the chronological age? Actual age of the child, 8 years. Child is able to make square. Copy a square. Square means 4 years he is able to do. Milestone making a square comes at 4 years of age. He is not able to make a triangle. Making triangle comes at 5 years of age. So he has not attained 5-year age, but 4-year wala milestone he is able to do. So what is the developmental age? It is the age calculated according to development milestone. So developmental age is 4 years. So how would you calculate DQ? 4 divided by 8 multiplied by 100. So the DQ of the child comes to be 50. What is your interpretation? Child is having developmental delay. This is how MCQs are asked in exam. On the other hand, we have intelligence quotient. Intelligence quotient is given by the formula mental age divided by chronological age into 100. Mental age is difficult to calculate based upon developmental milestone alone, and so it is more useful for older children. It is usually assessed by performing specific test or performing specific questionnaire method. If the IQ, what is the interpretation here? If the IQ of a child is less than 70, we say the child is having intellectual disability. It is also called as intellectual dysfunction. It is the old term. Earlier it was called as mental retardation. The term mental retardation these days is no longer used. And what are the categories here? If IQ is 51 to 70, the intelligence quotient or mental retardation is said to be mild. If it is written as equal to or less than 70. If it is 36 to 50, we call it as moderate. If it is 21 to 35, we call it as severe. And if it is equal to or less than 20, it is called to be profound. So these are the formulas and the things which can be asked in developmental quotient and intelligence quotient. Now remember, if question asks you what are the causes of developmental low IQ or developmental quotient, there is a huge list. You can categorize them into. Now if the question says what are the causes of intellectual dysfunction or mental retardation, there is a huge list. You can divide them into congenital causes and acquired causes and write down all the CNS insults, CNS disorders there which can have potential. So we are not concerned with that list. The brief outline of that list is already given elsewhere in the CNS module. What we need to know is the one-liners related to this. Remember, 3 one-liners here. All 3 are asked very frequently. Most common genetic cause of mental retardation or intellectual dysfunction in children is Down syndrome. If the question says what is the most common inherited cause of mental retardation or intellectual dysfunction, answer will be Fragile X syndrome. And if the question says most common reverse preventable cause of MR or ID, it is congenital hypothyroidism. Congenital hypothyroidism. These are the 3 things that you need to remember. In addition, you can just for the sake of theoretical knowledge, you can remember that causes of MR or intellectual dysfunction can be divided into congenital causes and acquired causes. Congenital causes will include multiple types of inborn errors of metabolism. It will include neurocutaneous syndromes. It will include torch group of infections. It will include the role of teratogens, and it will include various types of genetic diseases. Whereas acquired causes, they will include CNS infections, CNS hemorrhage, asphyxia, and severe prolonged hypoglycemia. Finally, it can involve kernicterus, and it can involve any toxin mediated injury. I'm not going into details because this is something you can easily elaborate based upon reading whatever has been taught to you in your CNS part of this module. So this is regarding the causes. Now, moving over to development assessment in preterm neonates. Calculating the exact timing of attainment of milestone is a problem in preterm neonate. If you remember the rule, we had said that it depends upon the CNS maturity. Preterm neonates are inherently born premature, and so they do not follow the rule what we follow for term neonates. In case of preterm neonates, for calculation, for seeing whether they are growing, whether they are attaining milestone properly or not, we take the corrected age of these children rather than postnatal age in terms of milestones. What do you mean by that? I'll give you an example. Suppose, there is a child who was delivered preterm at 28 weeks, right? Now, he is 4 months of age, 4 months of postnatal age, right? Parents say that the child is having no neck control. No neck control. What is your interpretation? Now, if you simply try to see what is his age of the child, 4 months. Neck control should come by 3 months of age. It has not started. So, you may be tempted to think that this child is having some developmental delay. But actually, the child is not having developmental delay. Why? Because in preterm babies who are delivered prematurely, you will not use the postnatal age. You will use the corrected age. So, what is the formula for corrected age? In these children, you first calculate the corrected age. The formula for corrected age is very simple. What is the current age of the child? You take it in weeks usually. Months में भी ले सकते हैं. Minus how much preterm the child is. To define how much preterm, 40 weeks. All the milestones which are there, na, what you remember, they are based upon a 40-week child. So what is the current age of the child? 4 months. 4 months means how many weeks? 4 multiplied by 4. So currently the child's age is 16 weeks. Minus how much preterm the child is. The child is preterm by, child should have been born at 40 weeks. Now he is born at 28 weeks. So how much is the gap? 12 weeks. So child is preterm by 12 weeks. So what is the corrected age of the child which comes out to be? It comes out to be 4 weeks. That is 1 month. So the child will have milestone related to 1 month only. We know that neck control will come between 2 to 3 months of age. So the child is not having any developmental milestone. So you will reassure the parents that yes, partial neck control should begin at 2 months. Complete neck control should come between 3 to 4 months. Now 4 month आ गया है, partial start नहीं हुआ है, parents are concerned with you. You reassure that corrected age of the child is only 1 month, and so wait for another 1 month or so and child will start to develop partial neck control, and another 1 month later the child will develop complete neck control. So that is why in preterm newborns you always take the corrected age for assessment. And MCQ point, till what time you use corrected age? Corrected age in case of newborns, preterm neonates is used till 2 years of age. After that, postnatal and corrected age concept is no longer followed. Finally, we come to the developmental assessment tests. The developmental assessment tests in children can be divided into 2 parts. There can be screening developmental tests and there can be definite developmental tests. The screening developmental tests are given by the mnemonic DDPT. First is your draw a man test, which is also called as good enough. Good enough is the surname of the person. Good enough Harris test, because they had given it. The second is your Denver 2 test. Third is your Fatak's Baroda screening test. And fourth is your Trivandrum screening test. On the other hand, definite tests include, only the names will be asked in exam. Bailey 2, the spelling is different from Lavan Bailey Wala Bailey. It is most commonly used definite test. Second is your Vineland test, also called as Vineland Adaptive Behavioral Scale. Third is your Stanford Binet test or Stanford Binet scale. And fourth is your Wechsler Intelligence Scale. So these are the developmental tests which are performed. Which are the common ones which are done? You perform a Drawman test, Denver test, Fatak's test, and Bailey 2 test. These are the commonly done developmental assessment tests. The other tests are also validated, but it all eventually comes down to the psychologist and child psychiatrist who's evaluating these children.